Squad is. Alright, so we're back with the skeletal system. In this video, we're going to discuss bones. Yeah, bones. Yeah, the bones. So there's 4 different types of bones. There's long bones, short bones, brain fart, there we go, flat bones, and irregular bones. So, sorry, I was thinking about Dr. Seuss. There's big fish, little fish, blue fish, red fish, there's thin fish, there's thick fish, there's, I don't know, he said something like that. But bones, long bone, short bone, flat bone, irregular bone. The long bones make sense here. Most of our bones are long bones, but it's when the length is greater than the width. So my nice humerus here, boom, that's a long bone. Femur, long bone. A lot of our bones are long bones. The length is greater than the width. Even the phalanges here, this length is greater than the width, so it is a long bone. Short bone is when the length is approximately the same as the width. So an example of this, short bone would be a carpal or a tarsal. There's also flat bones. That's when a layer of spongy bone is sandwiched between 2 layers of compact bone. So we're going to see these in the parietal, parietal bone, frontal bone, sternum, scapula. The flatter bones that need blood flow or need to be more vascular with that spongy bone. The spongy bone is surrounded by the compact bone, which provides blood and nutrients and also provides that protection we need. So that's most of the bones in the skull here: frontal, parietal, occipital bone, and then the sternum and scapular, a couple examples. And then there's also the irregular bones, which are pretty much just they have a complex shape and they don't fit into any of the other categories. So this would be our tuos coxa, our vertebrae, just bones that don't fit into the long bone, short bone, and flat bone categories. And then we also have some kind of ancillary bones, or bones we don't talk of as much, but they're called variable bones. They're sutural or sutural, however you pronounce that. Sutural means the same thing. They are embedded in sutures, and the number and location vary in every individual. So we all have them in the sutures of the skull, but the number and location do vary. And there's also sesamoid bones, not Sesame Street, but you could remember it that way if you want. Sesamoid bones are embedded in tendons that have lots of pressure. So they're embedded in tendons to relieve pressure. Prime example of a sesamoid bone is the patella, patella bone on each of our knees. They're usually much smaller than that, and say the shoulder or the foot between say the metatarsal and phalanges, but the number and location do vary as well here. So everyone has different amounts of these sesamoid bones. So that's the long bone, length greater than width. Short bone, length is approximately the same as the width. Flat bone, spongy bone, between 2 layers of compact bone. Irregular bone, complex shape, and doesn't fit into the other categories. That'd be like the vertebrae and the os coxa, and then there's the variable bones, the sesamoid bones, and sutural bones. And also, look up the anatomy of a long bone. Just Google it on your phone or computer. Look up, know the locations, and there's a little bit brief. Look up some brief information about the epiphysis, the diaphysis, metaphysis, articular cartilage. What else is there? There's the epiphyseal plate, epiphyseal line, compact bone, spongy bone, which we'll talk about a little bit more in depth. Nutrient foramen, make sure we're familiar with that. And the functions and locations of all of these would also be helpful to know. Definitely understand the periosteum and endosteum. So that is your homework on your own time here, but definitely look up the picture. Pretty self-explanatory. It's just going to be a long bone. It'll have the epiphysis, diaphysis, the metaphysis, the medullary cavity, which holds the red bone, marrow and yellow bone marrow. I'm just doing a quick run through right now. So here's the long bone with the nutrient foramen, allows O2 nutrients to get to the bone and to remove waste. That medullary cavity is lined with the endosteum. So the endosteum lines the inside of the hollow cavity within the long bone, the outside of the long bone. So here's the long bone, here's the shaft. That's aka the diaphysis. Around that is the periosteum. It's a real thin layer of adipose tissue and connective tissue. Also, there's the articular cartilage on the ends of the long bones to reduce friction, allow for movement. What else? Just want to touch on real quick. I'm giving you just a briefing. Please look these up in depth. Obviously, the pictures and the functions. Epiphyseal plate is a part of the metaphysis. It's pretty much the growth plate. I'm sure you're familiar with it. But once it's a thin layer of hyaline cartilage, and once the epiphyseal plate degenerates lengthwise, growth of the bone does stop. So that's a critical portion or part of growth of the bone. Lengthwise growth is that epiphyseal plate. Once it closes, growth stops, and then once growth stops, the epiphyseal line actually comes into play, and it's just a remnant essentially of the epiphyseal plate. But epiphyseal plate, we can see when we're growing. Once we're done growing, it degenerates. Well, it degenerates before we're done growing, and then the epiphyseal line will be the result there. And there's going to be compact bone in the shaft mostly, and then mostly going to be spongy bone in the epiphyseus, the ends of the long bone. So either the proximal end or the distal end. Going to be spongy bone with a thin layer of compact bone. So that's a quick run through. Once again, please Google it, the picture, and please look up some information about all the anatomy of a long bone. It's fairly straightforward, but that's bones. We'll see you back here soon.